Greetings, class! Back once again. I chose to go with the discussion about the Affordable Care Act. So let's dive right in, shall we? The Affordable Care Act, commonly known as Obamacare, was signed into law in March of 2010. Healthcare reform laws have kind of always been a common idea among those presidents, right? And so that goes as far back as Teddy Roosevelt's time. But let's be honest, the subject of health insurance, it's never really an easy one to comprehend for most of us, right? So simply put, the Affordable Care Act was designed to do 5 key things, and that's expand access of health insurance, increase protections for consumers, decrease costs, increase the quality of care, and not allow insurance companies to deny a consumer based on pre-existing conditions. So all of that sounds really great, and it was certainly a step in the right direction for healthcare. So let's see how the Affordable Care Act has impacted Charleston, West Virginia. So the Charleston area has its share of healthcare concerns, just like all of us. Mainly in West Virginia, period, obesity, poverty due to lack of good paying jobs, the opioid epidemic, and many other chronic illnesses like diabetes and heart disease that clog up the healthcare systems here. And one of the primary goals of the Affordable Care Act was to expand access to health insurance, particularly for low-income individuals. This is cited from a guy named Dr. Arnaz, and he, with some others with the Board of Public Health in our area, analyzed data collected over the years of 2011 to 2017 to figure out if more West Virginians were actually able to get better access to care. And what he found was that there was a 65% reduction in odds of lacking healthcare insurance in ages 18 to 64, a 27% reduction in the odds of inability to afford necessary care, and a 12% reduction in lacking a personal doctor. So there was definitely some improvements there across the board in our area for the access, but what about the cost? I can remember lots of debate surrounding this back in the times when the law was being talked about. And one side of the aisle felt like expanding Medicaid was just going to absolutely break their bank accounts, right, with the taxes. And then the other side, we're willing to fork over a few extra tax dollars if it meant lowering the cost of care for everybody, right? So that's exactly what happened. The coverage expansions reduced uninsurance rates, especially relative to earlier forecasts, and improved access to care and lowered out-of-pocket spending. So that was a lady named Sherry Gliad. So basically, expanding Medicaid programs increased federal subsidies and reduced the overall cost of insurance. And so the average taxpayers barely noticed anything over that time period, since the ACA was phased in over the course of 10 years, as opposed to instantaneously, where it would just be a massive hit, right? So lastly, there was a lot of grumbling about the quality of the care taking place. I remember people saying that doctors would just be crappy, and it just wouldn't go the way we all thought it would, right? But frankly, I never saw that happen. In fact, according to those over at ScienceDirect.com, by the way of The Lancet, it's a journal there they have, the ACA increased collaboration among U.S. healthcare and public health systems, which traditionally operated alone. So also think about the increased focus around prevention strategies, as that has become more of the norm, right? We're focusing more on educating people on how to stay out of the hospital, right? And so prevention is a lesson in accountability for the consumer. You got to take responsibility for your own care to a degree, which helps us all in the long run. Better preventive strategies lower admission rates, which lowers costs and increases bed availability for those that truly need it. Now, if we can get this opioid crisis under control, I think we'll be doing all right. Until next time, thanks for listening.